Let me hang on to it, it's our policy.
Can we have this one?
We have one violation.
Gentlemen, I understand, it's not just healthcare that people are worried about. Everybody's worried about healthcare. They're worried about how they're going to pay for it. We're worried about where we're going to get the money for the bailouts. We're worried about where the money's going to come from the stimulus package. I'm worried about what new taxes to pay for this is going to impact my kids' opportunity for life, liberty, and the pursuit of happiness. And we're talking about transparency here, and we need to also be talking about ethics. In regards to health insurance, what we're talking about now, Senator Reid, I have in front of me your voting record on health care. And I'd just like to take a minute and read this, and maybe you can clarify this at the end for me. And the Bingham Amendment was to ensure that American children have high-quality health coverage that fits their individual needs. You voted against it. The Colburn Amendment to provide an above-the-line federal income tax deduction for health care costs of certain children in low income. You voted against it. The Hatch Amendment to codify regulations specifying that an unborn child is eligible for health assistance. You voted against it. The Colburn Amendment to ensure that children do not lose their private insurance and that uninsured children can get access to private insurance. You voted against it. You did, however, vote for $246 million to go to Hollywood production for a movie.
Yes, right. Yes, you did. It's on record.
The McCain Amendment to amend the Internal Revenue Code of 1986 to reduce the income tax increase on Social Security benefits for the elderly. You voted against it. Okay? This is yours from your website taken tonight. Okay? To reduce income taxes for all working taxpayers. You voted against it. The McCain Amendment number 278 to ensure that the $1 trillion spending bill is not used to expand the scope of federal government by adding new spending programs. You voted against it. Are we talking about transparency and ethics? You voted against everything that you're talking about here today.
Wait a second, you're talking about transparency? Where'd you get that? My website.
From your website.
Yeah.
But what I'm saying is, you're voting against everything that you're saying about it. Why? And also, in the line of ethics, part of the reason that we're in the situation we're in today is while you were on the Senate Banking Committee, with your only obligation was to ensure proper lending. You took political contributions from the very banks that proceeded to do predatory lending that put us in this position where more of these people are going to lose their houses, more of these people are going to go bankrupt. Then you voted to give them the money for the stimulus package, to bail out the banks, and then you voted to give money to their CEOs who caused the problem. Where are your ethics? Please tell me now. Because the 56 letters that I've written to your office, none of them have been answered.
First of all, with respect to transparency, that's what we do. Put up the vote.
Be specific.
We were
Be
very
specific.
We were very specific. Now, let me do this. I'm trying to, with Sheldon, along with all my colleagues, to develop a health care plan that is going to benefit everyone.
You!
No. It's going to benefit, we hope, every American. It's going to also, we think, be one of those things that economically is going to no longer be a drag on the economy, like we're seeing now, the increase in costs. That is actually going to provide, particularly, I think, and hope, small business with the opportunity to get reasonable coverage for all their employees. That's the whole essence. I've been here for working, trying to do my best, making decisions that I think are for the best interest of people in Rhode Island, and that's what I'm going to continue to do.
Let me
You
just
say that all the time, but
add,
are those decisions that you've made against every single amendment for children you voted against? Is that what's good for Rhode Island? Is that what's good for my children?
Okay, I want to talk about the children of Rhode Island. The S-CHIP bill provides funding for children's health care in Rhode Island. I don't know anyone who's worked harder, and Sheldon hasn't been here that long, to get funding for children's health care in Rhode Island. What is the Fed? Start with the Fed. We have provided increased resources for the state so they can handle S-chip. In fact, I'm afraid that, Charlene can't have your son there for a while. So I've been trying to do my best and work hard to provide for this stimulus and everything else. And it's basically, and we're transparent about it. I take votes, they're reported, you got all the information off my website, that's the way it should be.
How much did you get from the banks?
$2.8 million.
Okay, can we go to the next question, please? Next question, please.
How much for food costs?
Next question.
Hi, this is Linda Kushner from the other room. First of all, I want to thank our senators for being our senators. I think Rhode Island sends a higher quality senator to the United States Senate than any other state. So thank you very much. Without a concern, however, I am concerned about what seems to be the folding in and the loss of the public option. And although, great, I'm glad to hear that, not yet, because it seems to me, even though the subsidies will help those who are unable to afford private insurance, there is no control on the level of the private insurance. And without having the competition of the public option, we will end up having a bill where the public is really subsidizing those private industries. So I want to ask you, please, what are your plans with respect to ensuring that we have a public option when we have our health care reform bill?
Thank you, Linda. Jack and I are both strong supporters of the public option that we voted for and crafted in the Senate Health Committee. I think it does a good job of balancing the importance of there being a public alternative that is not motivated for profit and that can take a longer view, on the one hand, without counting on unfair subsidies on the other, by requiring that it stand on its own 2 feet financially and comply with all the same laws that the private insurers have to. So I think it's a good and a fair piece of legislation. And the Blue Dogs over on the House side seem to like it. They adopted it essentially verbatim. So I think we did good work in the Health Committee on that. There's a long process going out ahead of us, and there'll be plenty of opportunities for continued debate on this subject. And the range of debate from nothing at all to a co-op to a public option to single payer is one that I think will be continued to the very end. And I think that the public option is very important. There was an old religious speaker in New England many, many years ago who used to say that if a stick is crooked, you don't argue with it, you don't try to explain it, you just put a straight stick down next to it. And in my view, the public option would be the straight stick that you put down next to the private industry. Paul? Wait a second. Nicole's coming.